Hi, I'm Dr. Charles Feinstein, and I'm a urologist and urogynecologist, and I'd like to speak to you today about urinary incontinence. This is a problem that's affecting your patients. There are 30 million women out there who are suffering from urinary incontinence. Urinary incontinence is a debilitating problem. It causes depression, anxiety, feelings of frustration, and these women are suffering in silence, and worse, very often when they're being treated inappropriately with medications and treatments that don't work. We know that for pharmacology studies, the drugs that are prescribed for urinary incontinence, the overactive bladder medications and the anticholinergics, is a $6 billion a year industry. We also know that of all of the prescriptions written for urinary incontinence, which as you know should be taken for the rest of the patient's lifetime, only 10% of them are renewed past the second month. That means that 90% of the prescription medications that we're writing for urinary incontinence are failing. They're not working. The patients aren't being helped. The patients aren't happy. They're continuing to lead very depressing and frustrating lives full of anxiety because of their urinary incontinence. What the patients need, most of all, is a very accurate diagnosis. An accurate diagnosis using every sophisticated modality that we have, using all of the skills, techniques, and the knowledge that we have about every intricacy of urinary incontinence. Many patients with urinary incontinence have an overlap of problems. Some have stress urinary incontinence, where they lose urine when they cough and sneeze. Others have overactive bladder, with the very famous TV commercial of gotta go, gotta go, gotta go right now. Other women have a combination with prolapse. Other women have problems where there are different types of prolapse. It can either be of the bladder, the uterus, or the rectum. There can be combinations of problem with intrinsic sphincter deficiency, where the sphincter itself in the bladder is not working. That in combination with overactive bladder and with stress incontinence and in combination with prolapse. We see other women with cystitis and worse with interstitial cystitis. All of these things are frequently overlapping, and that's why a simple diagnosis of urinary incontinence is not always the best diagnosis. And that's why the most prevalent treatment, which is pharmacological therapy, very often does not work, and it's proven not to work in 90% of the patients that we're writing prescriptions for. The majority of our patients need overlapping therapies or multimodality therapies. We have the facilities here to provide physical therapy for all of our patients with urinary incontinence. We have expert facilities here for diagnostic capabilities. We treat our patients with the same pharmacological drugs in combination with physical therapy, and where indicated, in combination with surgery. Our surgeries, for the most part, are very quick and simple and easy 20-minute procedures for the cure of stress urinary incontinence, all done on an outpatient basis in our own surgical facility here on Lakeshore Drive and Lawrence in Chicago. And the combination or multimodality approach is frequently the best approach for your patients to give them the happiest, best post-op results or the best results without needing surgery. But it's the multimodality approach that's needed based on very accurate diagnosis. That's why I'd like to invite you to send your patients to our facility so that we can see them, evaluate them, give them the most sophisticated tests that they need, and provide you, the referring doctor, with the best diagnosis possible and give you a treatment plan with multiple modalities that can best help your patients. We want you to be happy. We want your patients to be happy. And the best way to achieve that is starting with a very accurate diagnosis. We invite your inquiries. We invite your referrals. Again, Dr. Charles Feinstein, thanking you for your interest in all of our patients who are suffering from urinary incontinence. Thank you for listening.